Good evening again. I have the pleasure of introducing a very outstanding young man. His name is LeVar Stoney, and he's the Secretary of the Commonwealth of Virginia. His office is responsible for assisting the governor in his appointments of nearly 4,000 individuals to serve on Virginia's boards and commissions. His office also serves the Commonwealth through managing extraditions, clemency petitions, restoration of voting rights, very important, service of process, authenticating foreign adoption documents, certifying notary publics, and handling lobbyist registration, disclosures, conflict of interest filings, among a myriad of other things. Secretary Stoney served as a deputy director of Governor McAuliffe's gubernatorial transition. He was also the deputy campaign manager of Governor McAuliffe's 2013 campaign for governor. In 2008, Secretary Stoney served as the executive director of the Democratic Party of Virginia. At the time, he was one of the youngest state Democratic Party executive directors in the whole United States. During his career, Secretary Stoney has worked in various public and private sector capacities, including for State Senator R. Cray Deeds and former Delegate C. Richard Cramwell. Secretary Stoney received his undergraduate degree from James Madison University in 2004. In 2006, he completed the Virginia Commonwealth University Minority Political Leadership Institute's Leadership Development Program. He's a native of Yorktown and a product of York County Public Schools. He and his wife reside in Richmond. I think this is a young man that we're going to hear a lot from in the years to come. Please join me in welcoming Secretary LeVar Stoney.
Good evening. Well, first, I want to start by thanking Congresswoman Christensen and Dr. Puckrein for hosting this event tonight. Really glad to be here. I am LeVar Stoney. I'm the Secretary of the Commonwealth in the Commonwealth of Virginia. And on behalf of our governor, Terry McAuliffe, and the entire administration, I'm very pleased to join you tonight in recognizing the outstanding work of leaders who have fought to eliminate racial and ethnic health disparities. I would like to congratulate Senator Ben Cardin. I know Senator Cardin had to leave, and Dr. Ruffin for their well-deserved Lifetime Achievement Awards. Senator, thank you for focusing attention and resources to address health disparities by establishing offices of minority health in key agencies in HHS, and by elevating the NIH's Center on Minority Health and Health Disparities to an institute. Dr. Ruffin, congratulations on your recent retirement from the NIH, and thank you for the extraordinary achievements you've made in reducing health disparities and for making your life's passion for over the last 24 years. Now, you said you're retired, but I'm sure Governor McAuliffe can find something for you to do in the Commonwealth of Virginia. I'd also like to recognize Congresswoman Christensen, the first female physician elected to Congress and the only current sitting African-American physician in Congress, for her extremely capable leadership as chair of the Congressional Black Caucus Health Braintrust. Dr. McAneny for her service to her patients and to the help those in the field of medicine in so many ways. Dr. Chen for your numerous scientific achievements and for your vision to advance innovation through partnerships at pharma, and Dr. Puckrein for his tireless dedication to using evidence and data to eliminate disparities. Truly, this is the only way we can know whether we're making progress or not. As you well know, April is National Minority Health Month. Governor McAuliffe asked me to share with you some of the many ways we have placed health equity at the forefront of our agenda. Ensuring that all Virginians have access to quality health care, no matter their income, age, or zip code, is a top priority of Governor McAuliffe. Because it's just not just a health issue, it's a moral issue, and for us, it's an economic issue. When a parent, child, friend, or neighbor doesn't have access to health care, it creates an unstable environment for families and places a burden on our state's economy. We need to support a culture of health where people have access to primary care, preventive care, dental, and mental health services they need. Because too often, unfortunately, people without resources wait too long to seek care, and unfortunately, this can lead to dangerous situations for these patients and costly emergency room visits. I know what it's like not to have access to health care. As a kid born to basically kids having kids, father 19, mother 16, my father did not graduate from high school, did not graduate from college, but he tried to make ends meet, and as always, kids do get sick. And I do recall a moment as a kid, strep throat or something of the sort, where my father took me to the emergency room, and we get there, and as I sit on his lap, the nurse at the front desk asks whether or not my father had health insurance. He paused, and he said no. And I remember that awkward moment right there from my father, even though I'm not supposed to know what the situation's all about. But it was an awkward situation, and I remember it to this day. And I think about that story, and I've told the governor that story before, and these are the type of stories he hears every single day. And that's why he's been dogged in making sure that Virginians have the best health care possible. But we also need to fix our broken mental health system. Governor McAuliffe has been committed to this, and I'm glad that we made significant progress this year. Just yesterday, down in Charlottesville, Governor McAuliffe highlighted significant mental health reforms that was signed into law in his first 100 days. These reforms address Virginia's ability to respond to mental health crises and build our capacity to prevent crises before they occur. But we've seen how in different communities, there are major disparities in resources, and we need to do everything we can to fix that. One measure in which we've found disparities in is in the infant mortality rate. This is a key health indicator for any community. And there are large disparities in infant mortality rates between the white and African American communities. While we've made progress in Virginia over the last several years, we still have a lot of work to do. We have an infant mortality strategic plan, and our Department of Health is working hard to reduce infant mortality and ensure healthy pregnancies in Virginia by reducing disparities. Our administration is also investing state funds into cutting-edge research by awarding millions of dollars in grants to companies and researchers who are developing new ways to diagnose and treat chronic diseases like diabetes and cancer. We are committed to fostering an environment that encourages innovation. This spring, actually, Governor McAuliffe signed the legislation to increase the cap on the R&D tax credit, incentivizing more private companies to invest in critical research in areas that would benefit the Commonwealth of Virginia. We also understand that the most innovative solutions are found through collaboration. We are deliberately promoting and incentivizing collaboration across industry, academia, providers, and government to spur great discoveries of tomorrow. These discoveries are the ones that will save lives and keep people healthier for longer. And just today, the Virginia Biosciences Health Research Corporation announced $1.25 million in grants to 4 collaborative bioscience projects between Virginia's research universities, and private companies. These awards are being matched dollar for dollar by federal grants and/or direct industry contributions, creating a cumulative $2.5 million in investment. These projects will accelerate the discovery and development of new drugs to combat brain cancer, foster tissue repair in diabetes and heart disease, and more effectively treat inflammatory bowel disease. Finally, as you all may have heard, if you live in the DC area, we've been working diligently to close the healthcare coverage gap in Virginia, enable 400,000 uninsured Virginians who don't qualify for Medicaid and can't afford health insurance of their own to actually, in the federal health exchange, to have quality health care in the Commonwealth of Virginia. This is the single most powerful step we can take to eliminating unjust health disparities in the Commonwealth of Virginia. And every single day, my boss, Governor McAuliffe, has been on the trail, once again, even as the governor, going around the communities of color, rural communities, pushing for ending the gap in coverage for health care. And he's met a lot of folks who are against him. But if you know my boss, Terry McAuliffe, it's going to take more than one no for him to stop. Governor McAuliffe believes that this is the right thing to do morally, but it also builds the foundation for a stronger workforce and will build a stronger economy. In addition to everything I've shared, I came here specifically tonight to talk about our administration's latest commitment to ensuring a healthy Virginia for all. Today, we are pleased to announce that the Commonwealth of Virginia is all in with the I Am In campaign. This makes Governor McAuliffe one of the first governors to be all in for I'm In. But if you all know Governor McAuliffe, he's always all in. The I Am campaign was launched by Pharma and the National Minority Quality Forum to raise awareness about the need for increased diversity among volunteers in clinical trials. I'm In also supports the forum's Clinical Trial Engagement Network, which enables prospective volunteers to connect with clinical trials and provides industry, physicians, researchers, and academic institutions with data to help focus clinical trial recruitment. Without the patients who volunteer to participate in clinical trials, the development of new and effective treatments is not possible. Increasing diversity in clinical trials is essential to help ensure the availability of effective medicines and treatments for patients from all ethnic and racial backgrounds. That is why Governor McAuliffe and the Commonwealth's leading healthcare providers have come together to support the I'm In campaign. Governor McAuliffe's vision is that by working together, Virginia will develop a world-class medical research network that recognizes and embraces patient diversity. When you combine our commitment to enhancing access to life-saving therapies by closing the coverage gap with our willingness to invest in research and development, it's easy to see how the Commonwealth of Virginia is poised to become the leading state for biopharmaceutical research and innovation in the country. In closing, I want to thank Dr. Puckrein, the National Minority Quality Forum, and Pharma for their leadership in galvanizing this important movement to enhance diversity in clinical trials. We look forward to continuing this exciting collaboration and to working together to reduce and eliminate health disparities in the Commonwealth of Virginia once and for all. Thank you.
At this time, I'd like to bring up Dr. Puckrein.
First, Secretary Stoney, I want to thank you so much for your support for the I'm In campaign, for the governor's support. Secretary Hazel and his team in Virginia have been tremendous allies. We look forward to the collaboration. We think that Virginia has set the challenge for the other states in the nation, because if they don't get diverse, Virginia will get the bulk of the diverse clinical trials, and I always like a good competition. So thank you so much. I want to, because we were running a little behind time, and I wanted to make sure everyone had dinner, I wanted to pick up this conversation about the Institute for Congresswoman Christensen. I'm going to ask a couple of voices to join me, but I want to give a little quick predicate here that may not be understood. So in Washington, members of Congress rely on policy institutes and external groups to help them analyze legislation and its impact on particular populations. When we look at minority health, we have the Great Joint Center for Political Studies that has really done fabulous and tremendous work. They've been focused on the social determinants of health, and you've heard the research that John Ruffin supported, that life expectancy in America is determined by what zip code you live in. That if you live in the wrong zip code, you get to die earlier. That's a profound statement when you think about it. And that's important work that we need to understand why in certain zip codes we have these social determinants of death that put people to death earlier. We need to understand why that is. We also need to understand medicine, the science of medicine, how disease progresses, how do we develop medical therapies to control disease, how they vary across populations. When you look at medicine and the science of medicine and the organization of medicine, and in this town, reimbursement, we don't have a minority institute. We don't have people sitting around studying regulations in the context of its implications on minority population. That's what we're thinking about with this institute, to fill a very important gap so that members of Congress, when they cast their vote for their constituents, understand the implications of that legislation on their constituents. And we need your help to do that. One of the things that you've heard throughout all of this weekend is this is all about collaboration. Nobody can do this on their own. So the institute that we envision will help members of Congress do that. So I wanted to give you context for what we're doing so that part of Congresswoman Christensen's legacy, because she was that for the members of Congress. They would come to her and say, so what does this actually mean for my constituents? And we want to make sure that we institutionalize that. That's the point of the Institute. So we've got a couple of voices that I want you to hear. I'm going to ask them to be time sensitive with us, to come up. So first one is Tony Barbuda, who was the former Assistant Secretary of the U.S. Department of Interior. If Tony will come up. Oh, great.
Thank you very much. It's truly an honor and a pleasure to be here on this evening where you recognize Congresswoman Donna Christensen and Dr. Puckrein. I am probably the person least knowledgeable about the medical field or some of the issues that you have endeavored on in your advocacy to bring equity to our communities and to close the gap with health disparities. But I was nonetheless asked to come up here and speak a little bit about Dr. Christensen, Congresswoman Christensen, whom I worked for as the staff director on the subcommittee of natural resources during my time in the House and worked very closely with during my time as assistant secretary. So I was asked to talk about some personal anecdotal stories about Congresswoman Christensen by her personal staff, and then I got a call from the campaign staff and I was reminded about the non-disclosure agreement because we are seeking higher office, and so I'm not going to give those personal anecdotal stories. That's what Codels are for. However, I did want to speak to the fact that outside of her hard work and her determination to bring equity in the health field, she's done things outside of that, which all of us from U.S. territories are grateful for. And just as quick background, I'm the first person from a U.S. territory to hold the position of Assistant Secretary in the history of the nation. It's an honor that I hold very dearly. And I had many members of Congress, including Donna Christensen, speak up on my behalf. But during my time on the Hill, Ms. Christensen was instrumental in addressing issues of disparity and treatment of people in U.S. territories. And she was very instrumental in extending U.S. immigration laws in the Northern Marianas Islands, where for many years, led by the effort of Jack Abramoff, had fended off federal legislation to protect the foreign workers that were there. And she also helped to seal an agreement with the freely associated states, one which our nation holds very dearly, with the Republic of the Marshall Islands and the Federated States of Micronesia and the Republic of Palau. Some of this stuff you may not hear about at all, but nevertheless, they're important to our nation and to the security of our nation. And in her capacity as chair of our subcommittee, she also helped have the first field hearing on the military buildup that's going to occur in Guam, which was the first hearing that was held by Congress over the agreement between the United States and Japan to relocate U.S. Marines from Okinawa to Guam. During my term as Assistant Secretary, she was also very instrumental in furthering renewable energy. For the first time in the history of the department began giving grants to nonprofit organizations in all U.S. territories, and she was also very supportive of our effort to assess all buildings and classrooms of public schools in all U.S. territories. So inasmuch as we honor her tonight and the naming of the institute of her name, at least from my standpoint, there's much more to her than just her advocacy and her being a champion in healthcare. She's a champion, and it was mentioned earlier that she's a national treasure, and that couldn't be more important to us all, that she is a national treasure. She's got great things to come. We continue to want to work with her in the future, and I just wanted to bring that perspective to Donna Christensen. Thank you very much. I appreciate it.
Thank you so much.
Thanks. Appreciate it.
I'm going to ask Gulda Downer to come up. For those of you who don't know Gulda, if you're talking HIV in the United States, Gulda has been on the front line. Sometimes you think because the disproportionate number of African Americans with HIV that the resources are there, but we know better.
Thank you so much. Good evening, everyone.
Thank you for 2 minutes.
Yes. Health disparity presents considerable challenges that require a robust response from both individuals and organizations. And as a health equity advocate, Congresswoman Dr. Donna Christensen is able to strongly influence positive political, social, economic, and cultural changes in the diversity response. Because for her, advocacy is not only essential in galvanizing broad-based political commitment and mobilizing financial support, but it's also indispensable in continuing to place health disparity on political agendas where the spotlight can shine on a heightened sense of patient-driven community-focused approaches to addressing this urgent public health threat. For if we continue on this trajectory, in 2042, when this country is expected to be a minority-majority one, with most of the population being ill, health disparity will become truly a matter of national security. The Donna M. Christensen Institute for Health Equity, established by the National Minority Quality Forum, is but one means to help continue her legacy as a health equity leader, because for decades she has worked tirelessly to ensure that the Minority AIDS Initiative did what it was intended to do. She has been a key voice in championing the education of clinical providers to become culturally competent in reducing HIV-related health disparities, not only for ethnic and racial minorities, but for the disadvantaged, those among us who are underserved, who are vulnerable, and who are marginalized. It's through her work that Howard University and our consortium of HBCU medical schools have been able to train almost 50,000 clinicians during our time. In this singular event, she has been instrumental in helping to strengthen the HIV clinical workforce for the US and engage clinicians as a key component in our health equity. So I'm delighted on behalf of our consortium of national partners to enthusiastically pledge our support for the Donna M. Christensen Institute for Health Equity, as we not only build a legacy to honor her, but along with the Affordable Care Act, start a revolution in the national public health arena with a new paradigm for healthcare, for national health care, as this institute tackles this issue head-on and helps strengthen health equity and thus save the lives of millions of our own citizens. Congratulations, Congresswoman Christensen.
Linda Blunt from the Black Women's Health Imperative. This is a great organization that's been doing really tremendous work.
Good evening. So I'm Linda Blount, the new president and CEO of the Black Women's Health Imperative, and a fan of Donna Christensen. I'm in the fan club, so I'm a proud member of the fan club. For 30 years, the Black Women's Health Imperative has worked tirelessly toward achieving health equity for all women, but we put a special emphasis on one of the most underserved populations, our nation's 20 million Black women and girls. In fact, we're the only national organization focused on translating research into evidence-based programs, health education, policy and advocacy, and leadership development to ensure that no woman suffers poor health or dies because of where she lives, how much money she makes, or the color of her skin. So tonight, we at the Imperative are honored to be a part of this important celebration in which we recognize the legacy of Congresswoman Donna Christensen and applaud her commitment to eliminating health disparities and promoting health equity for everyone. When I took this job 90 days ago, so don't ask me hard questions, someone asked me, well, does Black women's health really matter? And the unfortunate thing is I really wasn't surprised that I even got that question. Well, one only needs to look at the great political courage and considerable talent of Congresswoman Christensen to know that the health of Black women really does matter. So it's only fitting that the National Minority Equality Forum establishes the Donna M. Christensen Institute for Health Equity. This institute will be vital in continuing the great work that has taken place, but to charting the course toward a future where we all can achieve optimum health. Congresswoman Christensen, you have always stood by the Imperative, and for that, we thank you. We look forward to partnering with this institute, and we honor your legacy as we realize our shared vision of health equity for Black women and girls in our lifetime. Thank you very much.
I'm going to ask Joyce Larkin from the Centene Corporation to come up. First, we want to, Joyce and her company has been a sponsor. We want to certainly thank her for that.
Good evening. My name is Joyce Larkin. I serve as Vice President for Corporate Community Relations at Centene Corporation. But very early in my career, I had the honor of serving on the professional staff of Congressman Louis Stokes, the first chair of the Congressional Black Caucus Health Braintrust. And there are a number of Stokes' former staffers in the room tonight, Fredette West, Millicent Gorham, along with a number of the fellows. It was under his leadership that we learned the true definition of health disparities and health inequality. But I recall when Mr. Stokes was prepared to retire, he said, I have no worries about the Health Brain Trust because I'm leaving it in the hands of a tireless champion, a fearless advocate, and someone who won't rest until the work is not only done, but the work is done well. Some 15 years later, so much has been accomplished. So many communities have been transformed. And equally important, the bar is raised so high for the work that needs to be done in the days and years ahead. This Donna Christensen Institute is not only a legacy, but it allows us the opportunity to continue the work that this great champion has laid before us. So I salute you, Congresswoman. I thank your staff, Britt Weinstock in particular, and all the members of your staff for a job well done. At Centene, it's been an honor to partner with the Congressional Black Caucus and follow you around the country. So we see the Institute as an opportunity to continue that work, and we pledge our support. Thank you so very much.
So we're on our way. We've got an institute. We're going to redeploy and continue the contest. One of the groups that's really been with us really for almost the 11 years that we've been doing this is the American Medical Association. And I'm going to ask their chair-elect, Barbara McAneny, to come up and say a few words.
Thank you very much. I want to thank the Minority Equality Forum and everyone here for inviting me to speak to you. And also, we are very proud at the AMA for the long partnership that we've held. This is my first time here. I feel like I'm about to miss the opportunity to see one of the legends in work, but I know she's going to do great things as the future governor in the Virgin Islands and with the Institute. So, Dr. Congresswoman Christensen, it was a pleasure to get to meet you. And to the entire group, this has been an amazing conference because watching the enthusiasm and the dedication and the willingness to really do the hard work that I've seen from people in this room is truly inspiring. As a practicing oncologist in New Mexico, I have to applaud you on behalf of all people of color and all people who are disadvantaged in our healthcare system. But I want to tell you a little bit about why I'm proud that the AMA is here sponsoring this and partnering with you. The AMA has a long history of working for the art and science of medicine and the betterment of public health, and that means everybody. We've done multiple campaigns along this line. We did the Hearing the Uninsured campaign. of trying to get people to have health insurance. We recognize that people without insurance die younger and live sicker than people who do. It's a major part of health disparities. And we've worked long and hard to try to work with that, culminating in our work and our early support of the Affordable Care Act. You might have heard that we got a little grief about doing that, but it's still the right thing to do. You know, and it's been interesting as we go around the country and hear some of the grief that we get given for that. But when you take it apart and you ask people, do you really think that insurance companies should be limited to 15% for themselves of your every health care dollar? People agree with that. Do you want your kids to be able to remain on your health plan until they're 26? They like that. Do you think that we ought to throw people out of the healthcare system for pre-existing conditions? Everybody says, no, we shouldn't do that, but I don't like the Affordable Health Care Act. You know, it's take your government hands off my Medicare. And it's not about Medicare. So it's been an interesting journey, but it's partners like this organization, the Black Caucus, a lot of organizations. I'm impressed with the women in Congress, too, who pull together and see the greater good. I want to tell you a little bit about some of the things that we're doing as we restructure the AMA and try to really focus on the things that are meaningful. And one of the things that we do that I think will be near and dear to your heart is we have the AMA Foundation. And one of the projects of the foundation that's been going on for a long time is the Minority Scholarship Program. If we're going to solve or at least address some of the problems of health disparities, we need physicians who look like the rest of the country. And the way we're going to get that is by overcoming the barriers to getting into medical school. We need to help people understand that and to get that money out to students so that deserving students can come to medical school and join us in our ranks. That's really important, and I hope you'll consider that as you move forward. But the other thing we're doing now is we're focusing our strategic plan on a couple things, and I had the honor of talking to you last night a little bit about what we're doing in medical education to promote team-based education, and what we're doing to try to improve physician outcomes so we can keep physicians from retiring. We want to keep them at work. But we're also doing a program called Improving Health Outcomes. And it wasn't hard to think about this. You know, you think about what do patients want? They want to be well. They want to be healthy. And what are some of the crises that are affecting our country today? It's the obesity crisis. It's prediabetes. It's heart disease. I didn't know that 30 million Americans who have access to health care still don't have their hypertension controlled. That's an issue. It leads to stroke, it leads to heart disease, it leads to multiple problems. But one of the things we figured out was that if I get 15 minutes of your time 4 times a year, I'm probably only going to have a very small impact on your life. I heard during one of the sessions a gentleman stand up and talk about, why aren't you taking this back to the community? Where is the community in all of this? Well, we at the AMA figured out that what we need to do is involve the community and to get the people where they live to recognize that controlling health is a self-empowering movement that means that you need to work with where people live. We're not going to solve prediabetes and hypertension by lecturing people 15 minutes at a crack 4 times a year. So we're partnering out of the box. We're partnering with the YMCA in a couple of pilot projects to see if we can really make a huge difference in keeping people well. Hypertension, diabetes disproportionately affects minorities. We need to make that go away, and we need to get that disease under control, because the best way to save healthcare dollars is to keep people healthy. And that's one of the major things we're working on. I'm thrilled to hear of this new institute. I feel like I've been present at a delivery. And so I think I applaud that, and on behalf of the AMA, we applaud that. And the Donna Christensen Institute for Health Equity, if you're funding it personally, I'm in. Thank you.
I want to ask Congresswoman Christensen to come up for our next awardee.
Well, I was told that I thought that someone had taken the opportunity to introduce John Ruffin from me, so I didn't come up prepared. I was just going to add my little 2 cents at the end. But it's really, this is such a deserving award. I've been working with John, I think, for more than the 18 years that I've been here. And someone asked me, well, do you know John? Of course I do. I said, we've been in cahoots with each other for a long, long time. And now that you're retired, I can say that. But John is, when I first came to Congress, John was director of the Office of Minority Health Research under the Office of the Director at NIH. We managed to take it to a center over many objections. The objections of several of the directors at NIH. And we thought we had arrived then, but we realized we had a lot more that needed to be done. And so we embarked on creating the Institute. Again, it was a tough battle. There were many people who felt that, I guess they felt minorities didn't deserve their own institute for research, because the objections I just didn't understand. But John and I worked, he worked on his end and I worked on my end. We had the great support of Senator Cardin, as you heard, and also Congressman Elijah Cummings. And we did it. But we couldn't have done it without you, and we so appreciate the work that you've done to improve the research infrastructure in our institutions, to provide our institutions who otherwise would not have an endowment with endowments, to increase the number of African American and other minority researchers. So the contributions that you have made in your time at NIH are a legacy that will live on long after you've retired and gone on to greater and better things. I don't know what those are. Maybe you'll let me know. But we really appreciate you, John, and we'd like you to come up, and maybe Gary will say a few words as well.
So if this was a baseball game and we were talking about a baseball athlete, we're talking about the Hall of Fame here. We're talking about legend. When I started to work in the area of healthcare, John Ruffin was the guy. John Ruffin was it. He was inside the institution helping to explain minority health. And that sounds like an easy thing to do. It sounds like, my goodness, you know, they're part of the American population. But for whatever reason, when you get to start to talking about minority health, it gets confounding. It gets absolutely confounding. And particularly if you start talking about distribution of resources and educating minority investigators and studying the issue of why minority populations have shorter life expectancies. You know that 50% of African American males die by the age of 65? That's the number, 65%, right? 50%. And so you say to yourself, so why is that? And John Ruffin has led the conversation to get answers to those kinds of questions. So it's really a tremendous honor and privilege to be here on this stage and recognize that he's just switched the battle point. He's redeploying and he's going somewhere else to continue to struggle. Thank you so much.
Thank you so very much. I have to tell you, I think that I'm probably the luckiest guy in the entire world, and I tell you why I feel that way. I feel that way because those of you who have heard that we started off as an office, and you've heard the story that the office became a center and then on to become an institute. But the part of the story that you don't hear enough of is that when we became an office, it was a congressionally mandated office. And when we became a center, it was a congressionally mandated center. And when we became an institute, it was a congressionally mandated institute. And so what I had the opportunity to do and to be, and did my best to try and be a good one, is that I'm just a good drum major. I listen well, I hear, and most of you who are familiar with the guidelines and dictate of the Congress, it says, ye shall do. So if you go back to the office and you read the law that created us as an office, it gave us some specific directions and things to do. And so I stand on the shoulders of some pretty good people who gave me orders, asked me to do something. The timing to do what they asked me to do, they gave me a difficult assignment, but timing is everything. They gave me these difficult assignments, but I was very fortunate. And I was very fortunate in the sense that I have a wife and 3 kids. And the timing with which I accepted the role of either the office director or the center director or the institute was just great as it related to my family, who was behind me 250%. To do what I had to do, trust me, took the support of my family. And I am so, so grateful to my wife and to my 3 children for tolerating me and making sure that I could do the things that were demanded of me. And there are certain people, when you receive an honor of this type, that you certainly want to thank, because you don't get to do certain things without the help of some really giants. And boy, have I been lucky. Donna Christensen is certainly one of those. And boy, I can tell you there's work for this new institute. We still have a sick minority population and issues that we need to address. We still have an issue of rural health where poor white people in places like West Virginia and Tennessee and many of the other places that I've had the opportunity to visit still cannot get the help that they need. And when they are in fact diagnosed, most oftentimes it's too late. We still have that issue. We're still living in a country with all of the progress that we've made, where minorities are still afraid to participate in clinical trials. Well, if you're afraid to participate in those clinical trials, and with good reason, we still remember Tuskegee, and we still remember many of the other obstacles and barriers that keeps us from participating in clinical trials. But what I also know is that if you do not participate in those trials, it's going to be very, very difficult for us to know whether or not these studies apply to the minority population as well. This new institute will have a lot to do in overcoming those situations. But I can tell you this, I'm optimistic though, because some of the programs that were put in place that I had the opportunity of serving as a drum major for, many of those have produced fruits. You, not me, said that you thought it was important for us to find a way to get the best and the brightest people in the country working on health disparities issues. You did that because you told me that I had to put in place a loan repayment program. And the Congress said that they were willing to give up to $30,000 a year, principal and interest, to those individuals who were interested in working in health disparities. That's the best thing since sliced bread. I know, because my son's a pediatrician and I paid his way. I oftentimes say to people, they ask me from time to time, what's going to be the next program? And I only halfway jokingly say to them often that I think the next program that the NIH ought to put in place is a parental loan repayment program to help those of us who have helped our kids to get through medicine. But I understand the barrier there. I understand the expense there. I understand what the price tag is for many individuals coming out of medical school. But I can tell you, Donna, because of the stick-to-itiveness that you, Mr. Stokes, Dave Satcher, Lou Sullivan, I can go right down the line and name all these giants. The stick-to-itiveness is paying off. Right now, I can tell you that there are over 4,000 or so what I call health disparities ambassadors. These are individuals whose loans have been paid off because they have agreed to be warriors and to participate in the solution in helping us to solve the issue of health disparities in this country. And so as the Institute grows, keep in mind that there are individuals out there now that you could turn to that previously you would not have been able to turn to. It was you and many of the other people in Congress who understood that community-based participatory research is so important to the whole solution when we start talking about social determinants of health. You can't do it without the community, and I don't mean community in the sense that we go in and do what people call helicopter research, where we fly in and get a sample of your blood and fly out and do something different. Not so today. We now have programs in place. Community-based participatory research means just that the community is involved from the beginning to the end. From the beginning through the research phase, through the evaluation of the research itself. Because of the Congress stick-to-itiveness, there are about 40 such programs in the country. And what is so good about it is that at least 11 of those 40 programs, guess what, are community-based programs. I don't mean programs that are linked to an academic institution, but a program where a community organization was able to apply and to receive funding to do research in the community. That's the solution, and that is the answer for social determinants of health and really getting to the roots of what's causing it. So I'm thankful, and I'm also very grateful for this opportunity to accept this award. But I accept this award, I can tell you, on behalf of so many hardworking people. A staff, I had a very, very small staff over the years at the National Institutes of Health. But that staff was very, very hardworking. And not only that, but I had the opportunity along the way to work with some just fantastic people at the world's greatest biomedical research institution, and that is the National Institutes of Health. It is, folks, it is the world's greatest biomedical research institution. But here's where you have to keep our feet to the fire, because I'll add just one little glitcher to that definition that I just gave you. It is the world's greatest biomedical research institution, but not for everybody. And it is your job to make sure that it is for everybody. And so that is the charge that I give to you. I had the opportunity of meeting, and I'll say this and then I'll sit, two fantastic women at the National Institutes of Health, and I do want to mention their names. I worked and I had the opportunity, when you come into the National Institutes of Health, I came in 1989, and when you work at the National Institutes of Health that long, I had the opportunity to work with 8 or 9 institute directors at the National Institutes of Health. But I can tell you there are 2 that stands out in my mind, which deserve recognition. One would be Ruth Kirstein. I have to tell you that I would not have gone to the National Institutes of Health were it not for Ruth. I was pretty satisfied with what I was doing. I was dean of arts and sciences at an institution, and I was pretty happy at that institution. She recruited me from that institution to the National Institutes of Health and mentored me. And what she taught me was the politics of science. That is so important to learn and to be able to work. It's not just being smart and doing other things, but understanding the politics of science. And the other woman at the National Institutes of Health that I had the pleasure of working with, who did so much for all of us, was Dr. Bernadine Healy, the late Dr. Bernadine Healy. And I tell you why Bernadine Healy was so important and in my life. Bernadine Healy said to me when we first met, she said to me that, you know, John, when I leave the National Institutes of Health, I want my legacy to be that I did everything I could while I was there for women's health. And she said, it's impossible for me to go on that venture and not be interested in minority health. And so what she also did was that you and many of you out here who understand this quite well, is that while we have a big budget now, when we started off, we had a very small budget, $1.5 million. That was the budget in the office. Well, we didn't know what to do with that money. We decided, though, that what we would do is that we would go around the country and ask you what to do with it. We formulated a group of individuals, town hall meetings around the country. We had about 4 of those meetings, and we asked you, as it relates to minority health and health disparities, what is it at the National Institutes of Health that we should be doing that we're not doing? It's the only question on the table. You answered. You talked to Dave Satcher, you talked to Donna Shalala, you talked to a number of individuals around the country who listened to you. And you gave us 13 recommendations. We brought those 13 recommendations back to the National Institutes of Health, and we tried to convert those recommendations to good science. But here's why I still put Bernadine Healy before you. Because even though we had those recommendations, you can't do good science, folks, without resources. Donna Christensen will need resources to run that new institute. You can look to do certain things, but without the resources to do it, you won't be able to. You can only dream. Well, I can tell you, Bernadine Healy said to me in 1992, and for those of you, look at Science Magazine, 1992, there's an article in there. Bernadine said, I'm going to take these recommendations to the Congress, and I'm going to ask for $42 million for a minority health initiative. Bernadine Healy took the message to the Congress. The Congress responded. We got $42 million for the Minority Health Initiative. That's the initiative that got started many of the things that we're benefiting from today. And so I'm honored that during my tenure at the National Institutes of Health, I got a chance to read some really, really giants who are interested in the same thing that all of us are interested in here tonight. So on behalf of those giants, I accept this award. Thank you very much.
So I want to introduce our last speaker for the night, William Chin, who's Senior Vice President of Science Policy at Pharma. Bill has been a real mentor to me. So those who know me know that I'm not gifted with great patience. It comes from my mother. My wife will tell you she met my mother, and my mother had a rule. You could ask one question, but you couldn't ask her another question. That was the rule. And I'm just telling you, you couldn't ask her two questions in a row. That was absolutely forbidden. And I think my daughter's like that, and certainly I suffer from the same disease. Bill has been a friend on a very important project. You heard Secretary Stoney talk about the I'm In campaign and the Clinical Trial Engagement Network. This came out of a conversation with Pharma. And I think this is a really important thing for you to hear and understand, and Bill will talk about it. But I want to set the stage this way. Most of my life, I spent as a historian, and I studied African American history in lots of different groups. And when I look at the African American experience, and I don't know if Dr. James is here, but he gave me a slide a couple of several months ago. And what that slide showed is it's really only 50 years since the Civil Rights Act. Prior to that, African Americans spent almost over 200 years as slaves, spent virtually another 100 years in a segregated environment with little access. Do you know in 1930 there were probably about 3 libraries in the country that an African American go and check out a book? And it's really only since 1965 that we became part of the body politic in terms of throughout the country having the capacity to vote and participate. And one of the things that's important in that next journey that we're about to take is our ability to collaborate with industry. Lots of folks don't like to hear this, but at the end of the day, we are a commercial people. If you look at all of the diversity in our country, it gets bound together in the marketplace. And what I've been extremely proud of is the response that Pharma had to the question of greater diversity in clinical trials. They made it an industry-wide initiative. I don't know of another industry-wide initiative to solve a problem that is confronting the minority population in this country. Automobiles, computers, education, home mortgages. I mean, you go down the list and you tell me of an industry that got together and said, I see a problem in our minority community, and we've decided to collaborate to solve the problem. And in this country, industry is social change. Industry drives social change. It does. At the end of the day, it does. And that's why I'm so excited about what Pharma has done in terms of taking up that mantle about clinical trials. And I'm just going to say one other word about this clinical trial business. It's about science. It's not just the science for is this drug safe and efficacious in this population, which is important, profoundly important. But if you go to the clinical guidelines written by all of our medical societies and associations out there, the science is predicated on the clinical trials. It's how we know what to treat diabetes and asthma and all that sort of thing comes out of those clinical trials. And so if minorities are not in those trials, then we have to rely on clinical practice to find out whether medicines are safe and efficacious, how diseases work through minority populations, et cetera. And we already know that we have tremendous variations with populations, and so we need to understand that. But then here in Washington, we've added a little curveball to the question, because we build performance measures on top of those clinical trials, on top of those clinical guidelines, I'm sorry. And those performance measures are how physicians get reimbursed for providing care, right? So you've got this tree that extends, the roots of it extends in clinical trials. And so what pharma is doing is not just trying to figure out whether a medicine works in a particular population or not. They're cutting to the heart of health disparities. They're helping us build the science. And so, you know, I was stunned. I mean, I went to the meeting and, you know, because I go to meetings and I bang my head against the wall because that's what I do. And so I was just amazed and honored and privileged to be part of this really important conversation. So, Dr. Bill Chin.
Thank you very much, Gary. Good morning. Seriously, good evening. It's really been a tremendous pleasure to be at this celebration, to hear about your accomplishments, Congresswoman, Dr. Governor St. Christensen, and to hear about all your accomplishments, Dr. Ruffin. I think your legacies are that we will be your staffers or your band members for the future. All the speakers before me have already really spoken about really the message that I want to bring today. And that is about what is missing in clinical trials these days. And it is about disparities. Disparities of participation of patients in historically underrepresented minorities in clinical trials. Now, I represent pharma, and pharma is a trade organization that represents many companies, many listed here, many of you sitting out in the audience. We are dedicated to providing innovative medicines for healthier, longer lives for our patients. Our task is actually really focusing on making those medicines faster and less expensively. But these breakthroughs really don't happen on their own, and it's a lengthy process, and you've heard already that it takes long clinical trials to be sure that our medicines are both safe and effective. These trials cannot happen without those individuals, those patients who volunteer to participate in clinical research. Without their participation, development of these treatments would not happen. We know that biological difference can influence how people respond to medicines. Now, look at Gary, look at me. We are very similar in stature, in personality, right, Gary? That's why we get along so well. But we likely respond to medicines differently. Groups such as African Americans, Asian Americans, and Hispanics I've said, are dramatically underrepresented in clinical trials. So think about the following statistics that talk about disparity. So African Americans represent 12% of the U.S. population, but only 5% participate in clinical trials. Hispanics represent 15% of the U.S. population, and they are represented in clinical trials at the level of 1%. Talk about disparity. And for all the reasons you can imagine, research that I've talked about, ethical, and on, it is so critical that we have this participation. Our industry has long really prioritized increasing diversity in clinical trials as a key goal. And so Gary has mentioned that we have, maybe for one of the first times, to bring together the whole industry in order to increase participation in clinical trials for underrepresented populations in a very meaningful way. And Gary, we mean to do this in the most effective way. 3 C's. We want to collaborate, communicate, and connect. Relative to the campaign, I'm not going to spend a lot of time about it. The Secretary from Virginia has already indicated that this is a part of what they do. We are proud, from the farmer perspective, to work with the National Minority Quality Forum to collaborate on the I'm In campaign. And you've heard it seeks to raise awareness of the importance of clinical trials and of the opportunities to participate in these clinical trials among patients in underrepresented populations. So I'm In is a patient-centered, community-focused campaign. The goal, as you've heard, is to increase awareness and connectivity to clinical trials. And we're doing this in many different ways. All kinds of media, whether it's digital or social, you've heard about it. Media relations, other advocacy. We have now to date engaged over 80 organizations throughout the country to help us serve as champions to spread the word. So whether you're a representative from a patient advocacy organization, a healthcare provider, a clinical trial sponsor, an elected official, we invite you to join us as an I'm In champion. I've mentioned we have a lot of resources that you can call on, and we'd be happy to provide this for all of you. I end by saying that we need to continue to collaborate, to communicate, and to connect. I'm In. Gary Puckrein is in. It turns out that the governor of Virginia, the Commonwealth of Virginia, I'm a citizen of the Commonwealth, are in. And then hope that you will join us by being in as well. Thank you very much.
At this time, I'd like to welcome back to the stage the hardest working man in show business, Dr. Puckrein.
Congressman Christensen, we're coming to the end of the evening. So, you know, a journey is now ending. We've done this for 8 years, and it's really been a great 8 years. I've learned a lot, and really through your tremendous leadership. And we're all going to go to work and make sure you're governor of the Virgin Islands, because I think the Virgin Island people will be very, very lucky indeed to have you as their leader. So, it's really with tremendous sadness, but joy at the future and the opportunity that you have. So I want to thank you so much for giving me the privilege of working with you over the last 8 years.
Thank you.
So the NMA folks want to say something to you. So let me just grab them.
Okay, it's really been a privilege for me to work with you, Gary. It's been a joy, a pleasure, and it's also been a very productive partnership, so it's really an honor. Oh, my NMA folks.
How are you? We just couldn't, being part of the National Medical Association, and I have to say, you know, as two presidents, being here, not only for your honorees and all of them, but to you especially, a phenomenal NMA member. And all of the NMA members that are in the audience, if you would please stand up, or extended family of the National Medical Association, or any physician who has dedicated their life to making sure that racial and ethnic healthcare disparities are eliminated. Stand up. Because the NMA was the organization that stood up for Medicare and Medicaid, who stood up. Do you remember the orange card? Do you remember when pharmaceutical industry was looking to how can we maneuver that? It was the NMA. And so I have to say, in light of that and in the work that you have done, John Ruffin, you know that it was a struggle. We know the struggle that you were under. Okay, not just what everybody saw, but the attacks and the knives and the disappointment and the lies and the deceit that you endured and that you endured and that you have endured. Because if we don't know our history, we are in danger of repeating it. And we're not coming back to this level. And if you know it or you don't know it, we need to have this woman as governor in the Virgin Islands, and that's going to require money. You heard about the super PACs? I'm not a federal employee anymore, okay? So I can talk. It's going to require money. Money. And to make sure that your institute, as Gary pointed out, is that it receives the money that is an example of what you have already done. What you have already done. We're not going back to mom and pop on peanut butter and crackers. We have got to make sure that the quality is there. And I know that Pharma has committed to that. So I'm just saying that we are very, very grateful. Gary, I appreciate this opportunity. The person who definitely mentored me as a president, I can't say more. You've got to see his presentation on racism in medicine. If you haven't seen it, we can make sure that that's available to you. So we want to thank you. We are greatly, what can we say? For all of the communities of color, not only in the United States, but globally. To you, to John, and to you, Gary. Thank you.
Thank you. You want to say something about that? Finally, we wouldn't even have gotten by this summit without our sponsors who are behind us. I want to thank you, our sponsors, for all that you've done for us, and we look forward to the collaboration. So somehow next year, we're going to have to get the governor of the Virgin Islands to make a trip here in the spring, right?
Absolutely. No question.
So from my heartfelt thank you to each and every one of you. Thank you so much.
And my thanks as well. Thank you for all of the support you've given me over the years. The honor that I've received, the Institute would not have been possible without all of you. Thank you so much.
Thank you so much. Good night.